Can you imagine being told you have 3 blocked arteries? This is after I walked into the ER. Can you also imagine being told the procedure that you need to have done is going to cost you $25,000 out of pocket because you are an expat with no insurance? This is not me complaining one bit about the cost, because here in Panama, the healthcare system is a fraction. I mean, literally a fraction of what it would cost. This type of service in the United States. But I do want to share with you their process so you won't be caught off guard like I was. So, let's get into it. Hello everyone, my name is Nicole, and I wanted to come in and share with you my experience of being an expat with no insurance living abroad here in Panama City, Panama. Being an expat has been an amazing experience for me. This is something that I never even contemplated doing. Because I am a retired widow, I came here on the pensionata visa and decided to pay for my medical plans out of pocket. I decided, because I thought I was relatively healthy for a 62-year-old, that I had time to get coverage before any major procedures were going to be needed. Boy, was I wrong. In April, I celebrated my 62nd birthday here in Panama with my sisters and had a wonderful time. Unfortunately, a few days after they left, I started getting a really sore neck, and I normally check my blood pressure anytime I have a sore neck or anything going on. I check my blood pressure because I do suffer from hypertension. Upon checking my blood pressure, I did notice that my pressure was up, but I wasn't sure if it was the chicken or the egg. Was it my pressure being up that was causing the pain, or was it the pain in my neck causing my blood pressure to rise? Either way, I decided I would, contact my doctor, and I went in to get a steroid shot because the pain was excruciating. After receiving that steroid shot, the pain did subside and I went about my day. A few days after that, I started having other issues. My head just felt really stuffy and a little bit of a headache. Again, I checked my blood pressure. Noticed that my blood pressure again was elevated. I knew something was wrong. I was starting to feel not nauseated, but just not myself. I contacted my doctor, and of course he said to take another blood pressure pill to see if that will bring my pressure down. But at that point, I knew something was wrong. I told my doctor, no more pills. We need to find out what's happening with my blood pressure. Something is going on. He agreed to let me come in and get an EKG done, and I had planned to do that the following day. I couldn't wait till the following day. My blood pressure was elevated to the point where I knew I needed to go in to the hospital. I contacted one of my friends here in my building to see if she would go with me, and of course, happy to go with me. And so we called an Uber, not a paramedic, but an Uber, because I've been told that is much faster and of course more affordable to contact an Uber driver than to try to get an ambulance to the Pacifica Saloon Hospital, which is about maybe a 15-20 minute drive from my apartment building. So we get to ER. First thing they want to know, of course, like any American affiliated hospital, is where's the money? You have to fill out the paperwork and also use a credit card or pay cash to be admitted. Once I put my credit card on file for them to use, I was then admitted into the ER. Being admitted into ER, they started immediately, of course, taking my blood pressure. Once they saw how high, they started me on fluids, and of course, they started to run more tests. Of course, they ran an EKG on me, and what else? A cardiologist came in and started discussing with me the results of my tests. And imagine my surprise, you guys, that 3 out of 4 of my arteries were blocked. 3 out of 4 of my arteries were blocked. According to him, the pictures looked like I had one artery that was 100% blocked and another that was about 75 to 80% blocked. And I don't remember what the other one was because at that point I was in shock. As the doctor continued to discuss my condition, he also was providing me with the cost that each procedure uh, would would be. I am an expat, and an expat without insurance. Everything would have to be paid out of pocket. Out of pocket. That means they want their money up front before any procedure takes place. Have to pay for that up front. More tests were done. They put some kind of a dye into my system, and we're able to see and get more photos of the blocked artery. And when he got the results back, he said that instead of doing the triple bypass, I could away with doing a triple stent install. That procedure would be less invasive and, of course, cost less. So we decided to go with the triple stent install, and I was told that that cost is going to be, the total cost would be roughly 25 to $28,000. Again, you have to pay for that up front, out of pocket. So on Monday, I walked into ER. I was told 3 out of the 4 of my arteries were blocked, and that I needed to either return back to the States if I had insurance and get treatment there, or if I did not have insurance and I wanted the procedure to be done here, then I would be responsible for the cost up front and out of pocket. I decided to have the procedure here. So on Tuesday, my daughter flew in. I used my credit cards to pay for the procedure up front, and on Wednesday I was scheduled for the procedure. The procedure went smoothly. The doctor was very pleased with the outcome. However, before I was released on Saturday, the billing personnel came into my suite, into my private suite, and told me that there was still an outstanding balance of about $10,000. The anesthesiologist doctor was not included in the cost of the procedure. What? What are you talking about, Willis? And they waited until, I guess, they felt I was able to handle this shock to tell me the day that I was waiting to be released from the hospital that I won't be released until I figure out a way to pay an additional $10,000 out of pocket. Up front. It's not even up front anymore because this is at the end of my uh, hospital stay, but I still have to pay $10,000 out of pocket. My stay in the hospital from the time I returned from surgery until the time that I left on Saturday was amazing. The staff was amazing. There was a language barrier. I will come back and do another video on that. But for the most part, I had excellent service under a wonderful doctor. He was very professional. He did speak both Spanish and English, even though it was kind of hard for me anyway, because no Espanol. Been here 2 years, I still cannot grasp the language. So, but I felt that because of the seriousness of my situation, um, I wanted that security of knowing that these people um, was qualified to do what needed to be done. Because ain't nobody got time for dying, right? I'm not ready to go yet. So I'll stop here, but I will continue on another segment of this video, because there is more to come. And if you're interested, make sure you like, comment, and subscribe to my channel. And hopefully, as I recover, I'll see you next week. This is the Lady at 60, signing off for now. Bye. Hasta luego.